Hello everybody. Today we will continue with our study regarding scanning modes. So let us begin the lecture. Regarding Doppler mode study, we should know, what is a Doppler shift? Remember, Doppler shift is created only when transmitted sound waves strike a moving object, like red blood cell. Doppler study cannot be done when object is stationary. A change between transmitted and reflected frequencies occur due to relative motion between the sound source, which is transducer, and the receiver, most commonly moving red blood cells in a vessel. Object can be moving either towards the transducer or moving further away from transducer. The frequency of reflected sound wave changes in both cases, and this change between transmitted and reflected frequency is called Doppler shift. The frequency does not change when the distance between the sound source and receiver remains constant, means object is stationary, so in such case no Doppler shift. Doppler study can be color Doppler study, which gives us a picture of blood flow direction and velocity of blood flow. For direction of blood flow, typical, the red color at the top of color bar indicates or display blood flow directed toward the transducer, and a blue color seen at the bottom of color bar is used to identify blood flow away from the transducer. Secondly, Doppler study can be spectral Doppler study, which is the graphical representation of blood flow velocity over time. Like color Doppler, it also tells us both the velocity and direction of blood flow, which are important in hemodynamic assessment. The spectral waveform is displayed above the baseline if the flow is towards the transducer, analogous to red in color Doppler, and below the baseline if the flow is away from the transducer, analogous to blue in color Doppler. Now, spectral Doppler study can be pulsed wave Doppler or continuous wave Doppler. First, we will study the pulsed wave Doppler. In this case, the machine sends out short bursts or pulses of sound waves and listens for the echoes that bounce back before sending the next burst of pulse. Pulsed wave Doppler is a focused and precise way to measure how fast blood is moving through specific areas of the body. Pulsed wave Doppler is like listening to specific points in a river to measure its speed. This type of Doppler is helpful for measuring blood flow velocities in specific vessels or areas of interest, such as the heart or major arteries, but the disadvantage is it can measure blood velocities to certain maximum limit, after which it start giving artifacts. Continuous wave Doppler is like continuously listening to the flow of the river to get an overall idea of its speed. Continuous wave Doppler sends out a continuous stream of ultrasound waves to measure blood flow velocities, but not from a specific region like in pulsed wave Doppler, but at multiple points along a vessel. The advantage of continuous wave Doppler over pulsed wave Doppler is that it is particularly useful for assessing high velocity blood flow, such as in the heart's valves abnormalities, as there is no highest limit, and it can measure the blood velocity without any limit. So we use continuous wave Doppler only when pulsed wave Doppler cannot measure that high limit velocity blood flow accurately. The reason why a pulsed wave Doppler can read a maximum velocity to a certain limit is that it has only one crystal, which is doing both jobs. That is, sending the pulse, and at the same time, receiving or listening the pulse, bringing the information. While in continuous wave Doppler, there are two crystals, one that is continuous sending the pulse, and the other that is continuous receiving the pulse. Unlike conventional color Doppler, which shows direction and speed of blood flow, power Doppler imaging is more of an amplitude-based color Doppler, depending on the strength of the returning signal, which means that it's more sensitive to low flow states, and also it is less angle dependent than regular color Doppler. So power Doppler enhances the ability to detect and evaluate blood flow, particularly in low velocity and small vessel scenarios, providing crucial information for various medical diagnoses and treatments, unlike conventional color Doppler which shown in two colors, that is red and blue. Power Dopplers show in one color, usually yellow, as it doesn't show the direction of flow, so it is not useful for situations where knowing the flow direction is important. In summary, Power Doppler is more sensitive to low blood flow than regular Doppler.